Right. So if you have read and understood, considering the surgical and optimization, kindly tell me which region are you looking at in the picture 8?
Ma'am, the picture 8 depicts the prosection of the femoral triangle region.
Very good. Okay. Can you please tell me what are the boundaries of the femoral triangle?
Femoral triangle is bounded superiorly by the inguinal ligament. Medially, it is by the medial part of the abductor longus. Laterally by sartorius, and the floor from medial to lateral is formed by the pectineus and the adductor longus medially, and iliacus and psoas laterally.
And the roof? By the
The roof is formed by the fascia.
Okay. Can you please tell me the contents of the femoral triangle?
The contents of the femoral triangle are the femoral nerve, common femoral artery or corresponding femoral artery, femoral vein, and the great saphenous nerve.
Okay, good. Can you please tell me, can you please tell me what are the contents of the femoral sheath?
The femoral sheath it has 3 compartments. The medialmost compartment contains the femoral canal. The intermediate compartment contains the femoral vein. Then the femoral artery is lateral to the femoral vein, and the femoral nerve is outside the femoral sheath.
What are the contents of the femoral canal?
The lymph nodes of Cloquet and extraperitoneal fat.
Okay, good. What is one physiological significance of femoral canal and one pathological significance?
The femoral canal is an empty space besides the femoral vein, which is there because if the femoral vein needs space to dilate in case of increased venous return or during increased abdominal pressure. And pathologically, the femoral hernias can descend down to the femoral canal.
Good. Can you tell me what do you understand by the term vascular lacuna and muscular lacuna?
Lacuna is yes, ma'am. This is present below and behind the inguinal ligament. The vascular lacuna contains the medial part of the lacuna. It contains the deep inguinal ring, the femoral vein, the femoral artery, and the genital branch of the genitofemoral nerve of the femoral branch of the genitofemoral nerve.
Yes.
And the lateral lacuna contains the femoral nerve, the iliopsoas muscle, and the femoral cutaneous nerve of lateral side.
Can you tell me if your consultant asks you to take ABG, how would you exactly locate the femoral vessel and how would you take the ABG?
And from the surface mark anatomy of the for the femoral artery is the mid-inguinal point from which we can take an arterial blood sample for ABG.
How is it different from the midpoint of the inguinal ligament? Or is it the same?
No, ma'am. The mid point of the inguinal ligament is the midpoint between the ASIS and the pubic tubercle.
Yes.
And mid-inguinal point is from
from
the symphysis pubis to the pubic tubercle.
Okay. Can you please tell me how the inguinal ligament is formed?
Inguinal ligament is formed by the aponeurosis of the external oblique muscle. It is from the pubic tubercle to the ASIS.
Can you please tell me the formation of the femoral sheath? Everything about the femoral sheath.
Femoral sheath is a downward extension of the abdominal fascia, anteriorly from the transversalis fascia and posteriorly from the iliacus fascia. It has 3 compartments.
Yes.
The medial compartment contains the femoral canal, which has the
those you have already told me. What is the length of the femoral sheath, please? The shape and the length.
A femoral sheath is a funnel-shaped structure with a length of 2.5 to 3 centimeters below the inguinal.
Can you please tell me this femoral triangle continues ahead with another triangle, with another canal? What is the name of it? And
Yes.
what are the boundaries?
And would be the boundaries are anteromedially. It is that is the roof is formed by the sartorius.
Yes.
Anterolaterally, there is the medial border of the floor is formed by the adductor magnus and longus muscle.
What are the contents of that canal?
The syphilis nerve,
Yes.
femoral artery, and vein are the contents, as well as the nerve to vastus medialis.
Okay. Can you please tell me the surface marking of adductor hiatus?
Now it is near the adductor tube. No, ma'am, I can't remember.
It lies between 2/3 along the line between
Within the magnus and longus.
And adductor tubercle.
Yeah, spine and the adductor tubercle on the femur.
You knew it. Yes. What are the other names of the adductor canal?
It is also called as the subsartorial canal and the Hunter's canal.
Good. Why is it called Hunter's canal?
As the Hunter was a surgeon who performed a surgery on femoral
Which muscle is this,
aneurysms.
Which structure is this? What does it call?
That is the sartorius muscle.
Good. Can you please tell me the attachment of the sartorius muscle?
The sartorius is attached to the anterior upper surface of the tibia.
And the other end?
On the medial side.
Yes.
Anterior superior iliac spine, ma'am. Proximally.
Okay.
And
what is
distally the tibia. Yes. Anterior medial surface of the tibia.
If you can identify this structure 8 over here, is it 8? 6, sorry. 6 here.
6. This is the femoral artery, common femoral artery.
Does it call common femoral? Okay, what is
sorry,
this?
ma'am?
Does it call like this?
That is
called like this? What is 8?
8 is the femoral vein.
Okay. And what is this one next to 7?
Next to 7.
No, next to 6. This one.
7 is the femoral nerve.
Okay, which muscle is this?
That is the adductor longus muscle.
17, please.
Pectineus muscle.
Good. Considering like you have to think of the boundaries, like you just told me of the femur.
Yeah, that is the floor. That is why. Yes.
Floor. Yes. Exactly. Good.
Yeah.
All right. So these muscles are supplied by which nerve? Muscles of the anterior compartment of the thigh.
Muscles of the anterior compartment of the thigh, being the sartorius and the quadriceps muscles, are supplied by the femoral nerve. Adductor magnus is only supplied by the obturator.
Good.
The adductor muscles are supplied by the obturator.
Yes. Good. Thank you. Right. Would you want to try this? Okay, at least tell me about this picture on the right-hand side, because this we can do with the leg as well.
Yeah.
So please.
Ma'am, this is a digital subtraction angiography of the femoral artery, femoral angiogram.
Yes.
Number 2 is the common femoral artery.
Okay.
3 is the lateral circumflex femoral. 6 is the superficial femoral, and 7 is the profunda femoral. 4 being the medial circumflex femoral artery.
And 5?
5. I don't know, ma'am. Which other branch?
Dr. Nida, can you add? Anyone else?
Yes, ma'am.
Yes.
Hello.
Please.
Yes, ma'am. Hello.
Yes, add please. What is 5?
Yeah, actually 6 is profunda and 5 is perforators, the first perforator.
Okay.
And 3 is lateral circumflex iliac.
Yes.
And the 7 is the superficial femoral artery going into the Hunter's canal.
Yes. Yes. Dr. Red, clear? You understand now?
Yes.
Can you tell now? Or?
Yes, ma'am. Yes, ma'am. The 5 is the perforating branches, 6 is the profunda, 7 is superficial, 3 is lateral femoral, and 4 is medial.
Yes, good. Lateral circumflex.
Okay.
Good. All right, good. This you can do with the leg. Then we'll be doing.
Yes, ma'am.
Okay, good.
That's the popliteal artery, probably. Yes, ma'am.
Yes. Started your timer.